Today, we'll discuss taking your humanitarian commitments to the next level from wherever you are in addressing these needs. A note on the language. Some people refer to these as humanitarian needs, which is fine. I like to use the phrase emergency preparedness and resilience, or EPR, because it broadens our view from a narrow focus on humanitarians responding to acute emergencies to a more holistic view that includes the full cycle of emergency preparedness, response, and recovery, involving governments, civil society organizations, development, and humanitarian actors. When a health system can efficiently and effectively respond to a crisis and restore health services, this builds health system resiliency. Given the challenges of the modern era with climate change and a global pandemic, cultivating resilience is critical to the health of every person on the planet. Next slide, please. So on our agenda for today, we will have a couple presentations on why you may want to consider including EPR, or emergency preparedness and resilience, in your new family planning commitments. Then we'll have a panel discussion on how two countries work to advance EPR. Then we'll break into breakout group discussions on topics such as who to engage and what information you can use to inform your commitment. We'll take some time for Q&A, and then we'll wrap up. Our main objective for this workshop is to increase our collective ability to make to explain why it is that new family planning commitments should include emergency preparedness, response, and resilience. To set this next slide, please. To set the stage for the rest of our conversation, we're going to show you a short video produced by the RAISE initiative at Columbia University. I feel like that video makes such a moving, compelling case for addressing SRH needs during crises. Now it's my pleasure to introduce to you Sarah Rich, Associate Director for SRH at the Women's Refugee Commission. Sarah will share findings from a 2020 landscape report on family planning access in humanitarian settings. Over to you, Sarah.
Thank you so much, Lorelei, and thank you to FP2030 for inviting us to present today. So WRC recently conducted a landscaping assessment of family planning in humanitarian settings and also across the humanitarian development nexus. The research was conducted from 2018 to 2020, and it included a literature review, a global survey on provision of contraceptive services in humanitarian settings, 3 case studies in 3 different settings, and 2 rounds of key informant interviews, one of which was conducted after the start of COVID-19 and provided us with information specifically on how COVID-19 is impacting family planning in humanitarian settings. Next slide, please. So I want to start just by highlighting one of our key big picture findings from the assessment. For our global contraceptive programming survey, 20 organizations completed this survey on where they're working globally, where they're providing health services, and where within that, where contraception is integrated into those health services. And we found that 1/4 of their health programs did not include contraceptive services. So this is quite a large gap that remains. And it's also important to note that the survey actually targeted organizations that regularly integrate contraception into their programs. So this proportion would likely be higher for many organizations that did not participate in the survey. So I wanted to start with this finding because it really highlights that contraceptive services or family planning services, I'm using those terms interchangeably, remain a gap in humanitarian settings, and that it's important for us to all begin to take action or continue to take action to ensure that women and girls are able to access contraception. Next slide, please. So I do want to draw out some quotes from the communities where we conducted our case studies that show why this is so important. Sometimes when people think about access to family planning and crises, they think, aren't there other things that are more important than family planning in these settings? But when we listen to the voices of people who have been affected by crises, we hear repeatedly across all settings, essentially, that family planning is in fact critical to them during these times. So I've posted these 2 quotes here. One is from a woman in Nigeria, and the second is from a woman in a refugee camp in Bangladesh. The first says that there are several things in this unpeaceful world today. If you're giving birth frequently, and if something happens, which one will you carry? Which one will you pack? And which one will you leave? I've had a contraceptive in my body for 5 years now, and I'm begging God to continue giving me rest. And then the second quote says, yes, I've done it, had an implant inserted. If I didn't do it, then I would have faced problems to raise children with proper food and care. We couldn't bring anything from Burma except our children. Here they just give us dal, rice, and oil. How can we fill our children's stomachs with this? So we can see from these 2 quotes from Nigeria and Bangladesh that across different settings, women find contraceptive access when they're displaced to be very important. Next slide, please. So we've pulled together here a slide that summarizes our key findings and recommendations. The first here is really a big picture a big picture recommendation, which is that we must continue to raise awareness that contraception is life-saving and that it's the standard of care that must be made available in all crises. And we must continue to build commitment among all of the relevant stakeholders, which includes governments, donors, and implementing partners across the humanitarian and development sectors, to provide contraception as part of the package of essential health services in humanitarian settings. And beyond that, it's really important that we continue to raise awareness of the role that each of these different stakeholders has to play in assuring access to family planning in humanitarian settings. And that's something that we'll be talking a little bit more, that I'll be sharing a little bit more about in detail on one of my next slides. Then in addition to that broad recommendation, WRC also found that within existing contraceptive programming and services, there are quite a lot of gaps that need to be addressed. And these include provision of the full contraceptive method mix, including LARCs and emergency contraception, addressing barriers that still exist to adolescents and other marginalized populations accessing contraception, addressing stockouts and strengthening supply chains for sexual and reproductive health, improving data collection and use, and building the evidence base on what works. And I do want to note for everyone that the Interagency Field Manual on Reproductive Health in Crises includes recommended indicators for SRH data collection in emergency settings. We also recommend that stakeholders invest in preparedness for sexual and reproductive health to mitigate the impact of crises, and invest in local stakeholders to ensure that when crises occur, the response is efficient and effective, and it puts us on the road to sustainable recovery. Next slide, please. There was a request from the pre-webinar survey to share some findings specific to how COVID-19 has impacted access to contraception in humanitarian settings. So I do want to share some of these findings, which are based on 29 key informant interviews that we conducted. They confirmed that that disruptions have occurred due to COVID-19. This has impacted service delivery, provider availability, contraceptive supplies, and community sensitization capacity or ability to conduct community sensitization. And these are related to some of the bigger picture issues that we've faced during COVID-19, like movement restrictions, lack of PPE, and facilities and staff being diverted to COVID-19. At the same time, we also learned that many partners have instituted adaptations to address some of these disruptions. And these have included telemedicine and digital protocols to counsel or refer clients on contraceptive services, instituting task sharing and task shifting, especially community-based provision of methods, supporting self-administration of subcutaneous injectables or DMPA-SC or Cyanopress, and as well, it's not listed on the slide, but distributing multi-month supplies of contraceptive methods like oral contraceptive pills and condoms. The interviews also explored what factors affected whether or not contraception was available amidst COVID-19. And we found that the key factors were really, first, preparedness for crisis. So that really gets to the heart of what we're here to talk about today. And second is the extent to which key decision makers prioritize contraceptive services and SRH services more broadly during the COVID-19 response. Next slide, please. So that takes us into some of the more specific recommendations that we've developed that we wanted to share today for your consideration as you think about your Family Planning 2030 commitments, including the commitments that you'd like to make related to emergency preparedness and response. So these recommendations include integrating emergency preparedness as a routine component within your SRH programming and coordination during stable times. So what might that look like? It's important to bring in expertise in emergency preparedness and resilience into standing national and subnational technical working groups. I know that all countries have these standing groups, often a reproductive health technical working group, a commodity security working group, etc. And bringing in folks who have expertise in this area can really help ensure that it's integrated along the way. It's also important to include sexual and reproductive health in your country's emergency preparedness plans and disaster risk management policies alike. So what might this look like? This can include incorporating the minimum initial service package for sexual and reproductive health into those policies and anticipating the barriers that tend to arise during emergencies, like those that I just mentioned around method mix, stockouts, data collection and use, and reaching adolescents and other marginalized groups. It's also important to budget and provide funding for emergency preparedness for sexual and reproductive health. These things can't be done without a level of investment to support them. As well, we recommend participating in humanitarian coordination systems that are active in each context to ensure that governments are active in participating in these systems and therefore kind of able to integrate them into the rest of the national context. And finally, we recommend making public commitments, such as through the FP2030 commitment, to providing contraceptive services in crises when crises emerge. This helps to ensure accountability and signals the level of public commitment that you have to this issue. Next slide. That's all the time I have today to share some of our basic findings. However, we have 6 full reports, and if you'd like to learn more, you can look at the Women's Refugee Commission's website and find all of our reports there, including from each of our case studies in Bangladesh, Nigeria, and Mozambique. Thank you so much, and I'm looking forward to hearing the rest of this webinar and participating in the discussion with all of you.
Thank you, Sarah. As the Women's Commission research shows, the risk of losing access to family planning and having an unintended pregnancy is real to women and adolescents affected by crises. When developing new family planning commitments, you may want to consider the crisis risk situation in your own country. The informed risk model indicates that most commitment countries are highly prone to human-made crises or natural disasters. None of the commitment countries rank as low or very low risk. When we think about high-risk situations, we think first about the hazards such as disasters, conflict, epidemics. The impact of a hazard on a community is also determined by 2 other factors. The vulnerability dimension considers the strength of the individuals and households relative to a crisis situation. And the lack of coping capacity dimension considers factors of institutional strength in terms of governance, disaster risk reduction, communications, infrastructure, and access to health systems. 71% of commitment-making countries rank as high or very high on the lack of coping capacity dimension. By investing in emergency preparedness strategies, governments improve their coping capacities so they can more quickly respond to and recover from crises, including thus increasing their resiliency. Preparedness efforts not only protect development gains and cushion the impact of emergencies, they're also cost-effective. Research shows that for every US dollar invested beforehand, saved more than $2 in future response costs. And the average response time was shortened by 10 days when investments were made in preparedness. Next slide. You may be wondering, what are the sexual reproductive health priorities in a crisis and who determines them? The priorities are defined by the Interagency Working Group on Reproductive Health in Crises and referred to as the Minimum Initial Service Package for SRH, or the MIS for short. One of those key areas for the MIS is family planning services. Within 48 hours of the onset of an emergency, which may disrupt your family planning services, you want to begin to ensure the availability of a variety of long-acting, reversible, and short-acting contraceptives, provide information and counseling on the options, and ensure that the community is aware of the availability of contraceptives for women, adolescents, and men, including those who are victims of sexual violence. Next slide. As Sarah mentioned, a key emergency preparedness and response commitment entry point is to incorporate EPR into your family planning policies and procedures, and to incorporate family planning into national and community disaster risk management plans. So you've got both arms of government making sure that these needs get covered. For additional strategies, please see the EPR commitment guidance found in the FP2030 commitment toolkit. These recommendations are based on the HIP strategic planning guide for family planning in humanitarian settings, and that suggests how to create favorable policies, budgets, programs, and accountability mechanisms to strengthen EPR for SRH. Ideally, your commitment drafting team will include first responder, civil society organizations, and humanitarian SRH specialists such as UNFPA to craft locally relevant and technically strong EPR commitments. Your country commitment team can start by using a rapid level of preparedness checklist found in the EPR guidance document, which will help you identify how to focus your commitment. Next slide. The EPR commitment guidance also provides links to key SRH preparedness and response tools that'll help you plan and implement strong EPR commitments and strategies. The Interagency Field Manual describes the fundamental principles and operational details for delivering SRH in acute and protracted settings. Ready to Save Lives Preparedness Toolkit provides EPR for SRH frameworks, case studies, and technical resources. The MISP Readiness Assessment Form forms a solid basis for developing an evidence-based plan of action to become prepared to start implementing the MISP within 48 hours. Please do not hesitate to get in touch if you have questions about these tools or want to discuss where to find financial and technical support for EPR planning and implementation. Next slide. It's now my pleasure to hand over to Nazreen Talbi, who is currently consulting with FP2030. Nazreen has extensive experience working with IPPF and UNFPA on emergency preparedness for SRH. She will moderate the panel discussion, which will give you an opportunity to hear from fellow focal points about their experience of advancing EPR efforts in Nepal and South Sudan. Over to you, Nazreen.
Thank you very much, Lorelei. It is indeed my pleasure to moderate this panel discussion with two experts who really have extensive experience and expertise in family planning in crisis settings. You really have now the opportunity to hear from two very different contexts, where one country made an EPR commitment and the other one did not, but still worked around FP in emergencies, and also discuss a bit their success factors as well as how they overcame some of the challenges. It's my pleasure to introduce our panelists, who are Kavita Arial, Section Chief of Family Planning and Reproductive Health from the Nepal Ministry of Health and Population, and Achwango Ezekiel, who is a UNFPA Reproductive Health Commodity Security and Family Planning Officer in South Sudan and works directly within the Ministry of Health. Please, let me start with you, Kavita. I hope you, are you connected? Are you there? Just
yes,
to make sure.
Yes.
Great.
Yeah. But my camera is not working properly.
Okay, that's fine. So let me start with you, Kavita. The original commitment that you submitted, that Nepal submitted in 2015, did not include a specific EPR commitment, but it was revised in 2017 to include a specific focus on emergency situations. Could you please explain why Nepal made this EPR commitment on family planning in 2017?
Thank you. Thank you for the this important questions. First of all, I would like to introduce the Nepal topographical situations, because topographically Nepal has divided into mountainous, hilly, and plain land, and it is very vulnerable to have a different kind of emergency situation like earthquake, flood. So that when we made the FP2030 commitment on 2015, just after a month, there is a very big mega earthquake, which was a 7.6 magnitude, hit the Nepal, and approximately 9,000 lives were lost at that time. And at the same time, 1,200 health facilities were completely and partially damaged, and some of the medical supplies and service deliveries were also hampered at that time. So that means so that we also face after the earthquake, we also faced some of the flood and landslide in the different part of the country, which also caused the disruption of our service delivery systems. So that we realized that we have to make our health system more resilient. And of course, the women, children, and adolescents are very suffer on the crisis situations. And we have to strengthen the HR service during the disaster time, so that we incorporated the EPR components into our FP2030 commitment, that is revised into 2017. We included these all components into our FP2030 commitments. So this was
And could you, thank you very much. And could you share a little bit what partners were involved when you worked around including this commitment around EPR? How did you advocate for it, or how did you manage to leverage this expertise of your partners?
Yeah, for this EPR FP commitment include in our FP commitments, there is so many involvement from the different government organizations and non-government organizations, including all the UN bodies also. Regarding the government organization, we have a health communications entity and training centers, family welfare division, who are completely work on the HR issues of the country as a technical expert or technical divisions under the Ministry of Health and Populations. These are the more involved agencies and other key RS partners who are the members of different networks in the country. Like we have a family planning subcommittee. This subcommittee is the one of the network which is regular basis we use to advocate the or discuss the family planning related agenda, as well as in the crisis situation. We have also another forum, that is RS subcluster, which is also activated during the time of crisis situations, which work under the health clusters of the country. And these all forums have a member of stakeholders who are really work on the RS issues. Like for example, we can take the UNFPA, Red Cross, and other key partners, even in the CSOs and other development partners. These all are involved in to advocate to introduce that component into the family planning commitment.
Thank you. It is indeed interesting to hear how with the different partners actually you worked together, and also using existing working groups that are already operating. Let me just move a bit with Ezekiel. So Ezekiel, in 2017, South Sudan commitment did not, South Sudan commitment did not have an explicit EPR component, but the government reported on efforts to strengthen SRH and family planning, preparedness and response in its self-reporting. So do you anticipate that there will be an EPR commitment that will be integrated into South Sudan's new commitment for FP 2030?
Thank you very much, colleagues. I appreciate this opportunity, and it is a pleasure for me to be part of this panel discussion and to share with you experience from South Sudan. To answer your question, I think, in my view, this is highly recommended. Although we didn't have, as you said, we didn't have a commitment on this in 2017, but this year or in 2030, FP 2030, I recommend, it is highly recommended to have a commitment on EPR, given the context of South Sudan. For your information, South Sudan separated from Sudan in 2011 after a long civil war that has destroyed this infrastructure. But sadly, after independence in 2011, South Sudan again fell into a civil war within itself that has generated further destruction and displacement. So the peace agreement now is being implemented, but no one can be certain about what will happen in the future. And we had an experience in 2016 when the parties who were fighting signed peace agreement, but quickly they went back to war, and this time it was more severe. So no one is certain about the future, although we have hopes that this peace will be sustainable. In addition to this, there are other challenges. For example, intercommunal fighting that's still going on in different parts of the country, and communities are fighting with arms, because everywhere arms are in the hands of the civilian because of the context of South Sudan. There are other disasters also, like floods that affect South Sudan, and now the COVID-19. So these challenges compound with the already weak health system will definitely lead to disruption of service provision, including sexual and reproductive health services. Therefore, it is of paramount importance to have a commitment, on emergency preparedness. It is very important for all stakeholders, including the government, to have in place a plan for emergency preparedness and response.
Okay, thank you.
Yeah.
Please,
I just wanted to add that emergencies are everywhere. And in the last winter, we have seen what happened in the United States. The snow and the change in the weather that has affected all sort of all aspect of services. So it is very important for all countries to have emergency preparedness plan in place.
And what do you think, because as you work for UNFPA, what could be the role of, what is UNFPA's role in financially or technically supporting emergency preparedness and response for SRH? What is your role in there?
Thank you very much. This is a very important, good question. UNFPA is already engaged in both financial through resource mobilization and technical support for comprehensive sexual reproductive health services, including as part of our emergency preparedness. So UNFPA provides technical support in different areas of sexual and reproductive health. This includes family planning, maternal health, adolescents, and more importantly also commodity security. This is one of the most important areas we provide technical support to all the partners so that they are empowered to provide the services, continuous service to the population. And this includes government and other agencies.
And do you think, what is your role in terms of advocacy? Do you feel, how do you advocate and to convince also policy and decision makers to implement these commitments?
Yes, we as UNFPA and other partners, they are working closely with the government and policy makers, including the parliament. In the parliament, there is a group called Parliamentary Network on Population and Development. So we engage, in continuous dialogue with the political policy makers in order for them to support efforts pertaining family planning and reproductive health in general. So to me, it is very important for all the stakeholders to continue with the policy dialogue and also experience sharing, because they have been doing a lot of work in this area of emergency preparedness in South Sudan. So we need to show them that, these are the achievements and these are the lessons learned in order to integrate sexual and reproductive health and family planning into emergency plans. This should be a continuous process.
Very important point about the experience sharing. And when going back to you, Kabita, as you made a commitment and you had some great achievements. According to your experiences, and when looking back, what would you consider are like main lessons learned or recommendation for future EPR commitment makers or for new EPR commitment makers?
Thank you for the questions. Regarding the achievement, now I'm talking about the last disaster situation already. That means I already mentioned the disaster situation which we faced during the mega earthquake and these all things, and we introduced the EPR component into our family planning commitments. And now also we are facing the COVID-19 pandemic situation. In these situations, we have so many lessons learned and some of the recommendations also. As we, in the context of Nepal, we have a very good policy environment, supportive policy environment, and have some lot of programmatic experience delivering IRS service in earthquake, flood, and even in the current situation. Of course, we have a heat into the different locations of the Nepal's, and we are introduced the minimum initial service package, and that the capacity enhancement part of already done, and MIS package is going very good to in this that works very effectively into the situation of crisis situation in the flood and this, but in the COVID situations we have a different experience of to ensure that service SRHR service, including family planning to the vulnerable groups. We have a very good experience or experience of community models, that is visiting service provider model, which provide the service through the outreach model and door-to-door systems. And in the context of Nepal, we have a good network of FCS, female volunteer system. That is a very good. We have a 52,000 FCSVs who work very nearly to the our service delivery and community linkage. They are providing the very good referral system. They are providing the even service to our hard-to-reach populations. As I mentioned already, that we have a one of the visiting service model. They are also delivering the service to hard-to-reach populations. FCSB network that also providing the services. These are the very good programmatic experience of our countries, which really fits to our service, our community. And I already mentioned adaptation of MIS training on the mixed MSP package and prepositions of this IRS kit with having strong data systems and developing the outreach model to reach unreached and vulnerable group populations are the recommendations for other countries who are making ERP commitments. So these are the few experiences we have in our countries and want to share in this forum.
Thank you. Thank you very much for sharing your experience. We are already at the end of our panel discussion, but before we cut off on the panel discussion, just very quickly, if both of you could just give like one key recommendation you would give to commitment makers, if you would think of one thing very quickly before we move into the breakout groups, that would be great. Maybe Ezequiel, if you had anything that you would recommend.
Thank you. Yeah, I would recommend that, we bring on board all the stakeholders, all the actors in sexual and reproductive health should be brought on board when we are developing any commitment. This is very, very important. This will ensure close coordination and also leveraging of resources. This is what we do in South Sudan. you'll find that there are so many actors, but when we come together, we will ensure that there are resources for family planning. If there is, we know that there is scarcity of resources, but through leveraging of the effort resources, we will successfully implement all our plans.
Very good point, and this will be discussed also in one of the breakout rooms. So thank you for bringing this up. Just a last word, Kabita, maybe?
Yeah, I missed to share we have a very good, Nepal is also one of the country to have a RH specific act, which helps to ensure the reproductive health as a right of women. So this is the very good policy environment which help us to make the service available even in the crisis situation. So this is the very good policy environment, supportive policy environment, and this make us to very easy to advocate even the sub-national levels, and even in the crisis ensure the service even in the crisis situation. This is our one of the good experiences and recommendations to make a good policy environment.
Thank you very much. Thank you very much. Again, a great point that will be addressed during the breakout groups when we talk about enabling policy environment. So this is a very nice transition. Thank you very much, Kabita and Ezekiel, for your time and for sharing this expertise and experience with all our participants. So I'm handing over now to Lorelei. Thank you.
Thank you, Kabita and Ezekiel, for sharing your experience of advancing EPR for SRH in your respective countries, and to Nazreen for facilitating this discussion. If anybody has questions for Kabita and Ezekiel, please put them in the chat and we'll come back to them at the Q&A section. Next, we're going to spend 20 minutes in breakout group discussions. Our facilitators from IPPF and Women's Refugee Commission will lead a discussion that will allow participants to reflect on the information shared today and to share your own experience for the purpose of increasing the participants' ability to advocate for EPR-related commitments. Really, everybody at the table has an equal say in terms of some experience with making commitments, some experience with advancing family planning. So we really want you to be able to learn from each other. The moderators from FP2030 will answer any commitment-related questions that arise and take some notes of high-level recommendations from the group. You'll now be randomly assigned to a group to discuss EPR policies, programs, and financing. Thank you. Thanks to the facilitators and moderators and participants of the breakout groups. We had a very dynamic conversation in the finance group. It'd be great to hear a couple of key recommendations or ahas that emerged during the breakout group. And I wonder, Onyinye, if you could share with us an idea or two that really stood out to you from the policy group.
Thanks, Lorelei. I hope everybody can hear me. So it was a very insightful conversation we had with colleagues from Nepal, Pakistan, and I believe, yeah, we heard more from Nepal and Pakistan. And a couple of the things that stood out to me was the conversation around the need to advocate to local governments. So for example, Nepal has more than 753 or about 753 municipal local government areas. And the challenge has been, how can they advocate to these local governments about the importance of providing family planning services to the communities? So they discussed the challenges that they've had around implementing policies at the local level. So that was one takeaway from it. Like, how do we get the national level policies down to the grassroots and getting the local leaders to understand why family planning services are critical? And then we also talked about supply chain, making sure that FP services are available in areas where there might be religious extremism and how that can hamper the implementation of policies. So yes, I think those are the key takeaways. How can we make local governments more responsible and accountable? And then how do we ensure that commodities are available when women are trying to access them?
Thank you, Anyinye. Really great points. Chung-hee, I believe you were sitting in on the program group. Was there anything that stood out to you that's different from what Anyinye just said?
Thanks for Lorelai. So we had a really insightful discussion within the group with the participants from Pakistan, India, Laos, PDR, and Nigeria, and India, and other countries as well. So we talked about what would be the key health system elements need to be in place to ensure the access of family planning and SRH during emergencies. And so it was pretty insightful to hear that the building blocks of health system is the same in the emergency setting as routine or normal setting. So supplies, providers, and facilities, the readiness of those infrastructures are all basic elements for strengthening the emergency preparedness and resilience, and capacity building of health facilities, and also experienced and trained staff are available in emergency setting. That's really critical. And also sensitization among the health workers to prevent any gender discrimination or bias is critical as well. And also, as Anyinye said, availability of SRH commodities and medical equipment, and coordinated system, and also kind of existence of a task force and interagency committee for rapid response is critical, and also proper referral systems for emergency. Data collection, analysis, and use of data was mentioned also as a key system element, and also as a way to assess which are the gaps in the prioritization of this. Some of components to be included in the EPR related commitments. And let's see.
So I'm gonna thank you for that. A lot of great points, and I'm hearing some common themes from the finance group. Guillaume, would you like to share one or two ahas that came out of the conversation for you?
Thanks, Lorelai. So our group focused on the financing related questions. On the question on how to determine the needs to be funded to prepare and respond to a crisis, several key answers. It's very important to convene government, humanitarian and development actors, to have a collaborative approach to define those needs that need to be costed, need to consider the evidence, of course, and the experience that we have in country to inform those discussions. Depending on the country, the needs could be different, depending on the groups, on the specific geographies, etc. When there's a disaster, the starting point is obviously to do a rapid assessment of the situation that can also inform the costing discussions. And finally, so we spoke about the various strategies that could be developed to ensure sufficient budget for SRH preparedness and response. And one of the participants stated that there's a need for a strong advocacy strategy to engage with Ministry of Finance and ministries in charge of budget allocations, with Parliament as well. Once they understand the needs, they are more likely to allocate more funds towards preparedness and response. And we need to do this in times of crisis, but also on an ongoing basis in order to situate the need for family planning in crisis during the development of annual budgets at the national, at the state level, etc. And then we briefly talked about the types of funds that could be considered and advocated for. One of the participants stated that those funds could be and should be and often are available at various levels, the global level, but also at the state and subnational levels. And I think, Lorelai, you were interrupted, unfortunately, when you were starting to describe some of those available funds available. Thanks.
Thank thank you to all of our moderators from the country support team of FP2030. A lot of great points, and from their notes, we'll consolidate that and share that out. And I'll add in those points that got cut out from what I was going to say at the very end of the finance discussion. So we're coming in close to the end of our session. And I wanted to come back to our initial question that we opened with, which is, why should family planning commitments include emergency preparedness and response? And I think that what we've heard today in the course of the presentations and the conversations, so rich. I really excited just how much we were able to pack into those 25-minute breakout group conversations. But some of the key elements that I heard of the justification is that access to family planning is a fundamental right, that the need for protection from unintended pregnancy is heightened during emergencies. And with proper planning, it's feasible to provide contraceptives soon after a crisis hits, if you're prepared. Next slide, please. Next slide, please. So based on our past experience and expert guidance, we have a set of recommendations that mirror very much some of the themes that came out of the Women's Refugee Commission research and some of the conversations we've just had in the breakout group. For national decision makers and those who influence the government, the recommendation would be to ensure that country commitments, policies, and budgets promote the inclusion of family planning in emergencies and consider both preparedness and response. Donor champions would recommend invest in EPR for SRH to protect family planning access when it's needed most, including through pooled and multi-year funds that can allow for shocks to be recovered from more quickly. Development agencies, we would encourage to integrate emergency preparedness and response into family planning advocacy and programming as a part of universal health coverage and health system strengthening. And for humanitarian agencies, integrating family planning across health, nutrition, protection, education, and empowerment programs makes it a much more likely proposition that it will get covered. Family Planning 2030 welcomes EPR commitments from all 4 types of entities and looks forward to continued collaboration with all of the FP 2030 focal points and other organizations with us here today. Next slide. So a few concrete next steps to take your FP 2030 commitment to the next level. Those include reviewing and sharing of the very succinct 4-page EPR commitment guidance that you'll find in the commitment toolkit. Use the rapid preparedness checklist to identify gaps. Include stakeholders with EPR for SRH experience when drafting new commitments. Advocate for explicit EPR commitments. And by this, I mean that maybe rather than referring to crisis affected populations as hard to reach or other vulnerable groups, to unpack that and be explicit about reaching populations affected by crisis, such as natural disaster, conflict, and infectious disease outbreaks, which makes people more vulnerable and health systems more fragile. Another step you may want to take is to please stay in touch. We want to discuss with you the situation in your country and to foster learning between countries. FP 2030 will send a follow-up survey, and we welcome your suggestions for what more FP 2030 can do to support EPR commitments. We have a few minutes here in which we could do a couple of questions. I'm just looking to see if there were any questions that came in from the chat. And Nazreen, were there any in the chat that we wanted to loop back to before we wrap up?
Hi, I don't think from the chat directly, but there were maybe a few from the pre-workshop survey that could be interesting. And I saw that it came up a lot about assessing gaps. How do we make sure that EPR is taken on board? How is that important? And I think you mentioned now the rapid assessment checklist, which is really key, and the EPR commitment guidance. And I just wanted also to highlight again the Ready to Save Lives toolkit, which has the learning briefs inside, which bring a lot of experience from different contexts where you can get inspired from when developing your commitment. And also the MISP readiness assessment, which is really a tool that will help you identify your gaps in terms of policy, but also financing, programming, capacity building, and also help you prioritize. What do I start with? Because you won't be able to do everything at once, but this will really help you to see with what should I start and then build on in order to be better prepared.
Right, very good points. And I think, thank you for bringing us back around to the rapid preparedness checklist that, you know, at an early stage with commitment makers, you might not have a lot of in-depth knowledge or data on how strong the system is, but you may have a sense that you can quickly discuss and identify gaps. If in doubt, start with incorporating development of a policy that includes emergency preparedness as part of your family planning programs, preparedness and response, and including family planning in your emergency response policies. That's a solid place to start without even doing an assessment. But the MISP readiness assessment that Nazreen is describing is a consultative process that brings stakeholders to the table. So all of the FP2030 focal points and the different key groups that you mentioned, such as Ministry of Finance, other sectors you would want to bring to the table to look at kind of systematically, if you take a health systems approach, where are the gaps in being prepared to deliver the MISP quickly after the onset of an emergency. And that will help you go into more detailed action planning and budgeting for addressing the key gaps in your settings. I'd like to offer my heartfelt thanks to the presenters, panelists, moderators, facilitators, and the FP2030 webinar team that ran the workshop from behind the scenes. I'm also very grateful to all of the focal points who joined us today to learn and to share your experience about advancing EPR efforts in your country. We've come a long way since the need for family planning in humanitarian settings was raised in the 2017 Summit on Family Planning. And I look forward to working with you to take your EPR commitments to the next level. With that, we are at time. So I wish you a very nice day, a good evening, and I look forward to being in touch with you in the future. Bye-bye.